This video segment will help discuss cataracts and cataract surgery. Cataracts are a clouding of the natural lens inside the eye. I like to make the analogy that the lens inside the eye is like an M&M, both in size and in shape. And when we are born, the chocolate inside is clear, and as we grow older, the chocolate gets cloudy. Cataract surgery is the definitive treatment for cataracts. In cataract surgery, we effectively create a circular opening around where the M is stamped, and we use ultrasound, a little jackhammer, to liquefy the chocolate that's inside the candy shell. We suck out the chocolate, and in that candy shell, we implant a new lens, which is basically like a little plastic frisbee. And we are able to do this without any stitches because we take advantage of the natural anatomy of the eye. All of this is done through two small incisions, a 1 millimeter and a 2.75 millimeter incision. It's all rather remarkable. Cataract surgery is actually the most commonly performed surgery in the US. It's an outpatient procedure, and the surgery itself takes about 20 minutes to do. During the surgery, you'll have an anesthesiologist by your side and an IV placed with some medicines to help keep you relaxed but awake during the surgery. Some patients who have more anxiety may actually require some more relaxing medicine, and that certainly can be arranged for each individual patient. At the end of the day, cataract surgery, even though it's commonly performed and is very successful, is still a surgery. That means that there are risks, including bleeding, infection, and need for further surgery. Though these risks are very small, for example, the risk of going blind from an infection that is so bad that it causes you to go blind is about 1 in 10,000. While that number is low, it's not zero. And for that specific reason, we must, for each individual, balance the risks with the benefits to make a decision about cataract surgery. Once upon a time, the term ripe was used, that we would only proceed with cataract surgery when the cataract was ripe. We've now changed our approach, and the decision to do cataract surgery, in my opinion, is based on two facts. One, what the clinical exam reveals. And hopefully soon I'll have a chance to examine you and comment on the actual clinical stage of your cataract. But the second important factor in deciding on cataract surgery is how much the cataract is bothering the patient. As it turns out, as the lens inside the eye gets cloudy, it can have several manifestations on your vision. Often patients complain that their vision is not as crisp as it used to be. To some degree, with early cataracts, a patient's glasses can be improved in order to help the vision become better. However, there sometimes is a plateau that is reached, and at one point when the cataract is cloudy enough, changing the glasses simply will not improve the vision. Many patients will comment with their cataracts that it's more difficult to drive, that the road signs are no longer as crisp and they have to approach the road signs and almost miss their turn before they really realize what the road signs say. Other patients may note that it's more difficult to read. For example, the newspaper, the print seems more faded and they're having to turn on a lot of light surrounding them in order to get the letters to really pop off the page. Other patients will comment that driving at night has proven to be a challenge. With the pandemic, many of us are driving much less at night, but being on the road, oncoming headlights can induce a fair amount of glare, making it more difficult to see the lines on the road. Taken together, we evaluate each individual patient's symptoms and weigh how much they are affecting each individual's activities of daily living. Sometimes some patients notice some changes. It's maybe more of an annoyance or a casual observation, but they're not particularly bothered. Other patients are significantly affected by the changes in their vision, and it's to the point where they can no longer do the things that they enjoy. In my opinion, when the cataract is clinically present and is affecting the patient so that they cannot enjoy their usual activities, it makes sense for us to consider cataract surgery. With cataract surgery, we always operate on one eye at a time. Usually we start with the eye that's more affected, that's having more problems with vision. Typically, we wait 2 weeks before moving on to the other eye. The reason for this is to allow appropriate healing of the first surgery before we commit to the second. Typically, the recovery from cataract surgery requires eye drops that are used over the course of 1 month. These drops typically include a steroid eye drop, an antibiotic eye drop, and in some cases we also use a non-steroidal anti-inflammatory eye drop. These drops are used in combination over the course of 30 days, and we give you a daily schedule to follow so that you can keep track of what drops you need to use. Typically, the surgery is done on a Wednesday. I operate at the Johns Hopkins Ambulatory Surgery Center in Bethesda. When you arrive in our office, which is 6430 Rockledge Drive, the surgery center is actually the building next door, 6420. The surgery center there is well equipped with whatever I need in order to successfully complete surgery, and we've been operating there successfully for many years. Cataract surgery itself is done on a Wednesday, and I operate starting at 7:30 in the morning, and I go all the way until the early afternoon. The scheduling of patients is usually dependent on their health, and those patients who are either a little bit older or a little bit more complicated in their medical history are typically scheduled earlier in the day. The day after surgery, which is a Thursday, you would return to the office, have a check on your vision, your eye pressure review, your medications, and have any of your questions answered. We may then check on you 1 week later to see how the recovery is coming along and confirm that you are ready to have your second eye done if you need. Most patients elect to have both eyes done in the same approximate time period simply because they want to get things sorted out and then have an updated glasses prescription. It is, of course, dependent on the individual and will review whether 1 cataract surgery or 2 makes sense for you. With cataract surgery, as I mentioned earlier, we not only remove the cloudy lens, which is the cataract, but we replace it with a clear plastic lens. This lens actually has some prescription embedded within it. And at the time of your clinic visit, we will have to do several measurements to measure out the eye and determine exactly what power of lens to put inside the eye. It turns out that there are actually 3 fundamental categories of lenses. There is the standard lens that your insurance company will cover, and we have a lot of long-term data for, which is called a monofocal lens. And that means that the lens is of one uniform power. And what that allows is for the patient to have one focal point or one length of distance which is in focus. Typically, many patients wish to see well far away, and then they will commit to wearing reading glasses. And these can sometimes just be over-the-counter reading glasses. There are some patients who have their whole life been able to read comfortably without glasses and have worn glasses for driving and watching TV, and they wish to maintain that set of vision. For those patients, we target nearsightedness so that after cataract surgery, they can continue to read without glasses, but still would need glasses to look far away, such as for driving and for watching TV. Some patients have something called astigmatism. Astigmatism is where the eye is shaped more like a football rather than a basketball. So we're talking about the curvature of the cornea, which is the clear window on the center of the eye. When you come in for your evaluation, we will measure to see how much astigmatism is currently in your prescription glasses and how much astigmatism is coming from your cornea. Patients who have significant astigmatism may be eligible for the second category of lenses called toric or astigmatism-correcting lenses. It is important to note that there are 2 fundamental types of astigmatism, regular and irregular. With regular astigmatism, the astigmatism distribution is mathematically symmetric, and we do a special test that measures the shape of your cornea so that we can determine the type of astigmatism that you have. If you have a significant amount of regular astigmatism, we can discuss whether an astigmatism-correcting lens may be appropriate for you. However, there are some patients who have a significant amount of astigmatism, but it is of the irregular variety. And what that means is that the astigmatism cannot effectively be corrected with these special lenses, and one must then wear prescription glasses for far away and up close, and potentially everything in between, after their cataract surgery. There's a third category of lens called a multifocal lens. This lens is designed to help you see up close and far away. There are several varieties of these lenses, each with individual optical changes to help optimize vision. While many patients who pay out of pocket for these premium lenses are thrilled to have a decreased dependency on glasses, it is important to note that these lenses are not appropriate for everyone. For example, if you have irregular astigmatism, if you have other serious eye problems such as macular degeneration or glaucoma or diabetic changes, then we may not wish to consider this specific type of lens for you. Furthermore, there are some patients who report additional problems after cataract surgery when they have these lenses implanted. For example, increased glare, which is often one of the symptoms that leads people to wish to have cataract surgery, and also decreased contrast sensitivity. When you arrive for your appointment, we will discuss what your wishes are as far as freedom from glasses after cataract surgery, and also take into account what your personalized measurements reveal to discuss what is the best lens option for you. Finally, I'd like to take a moment to discuss the logistics of cataract surgery. As I mentioned earlier, cataract surgery is an outpatient procedure, and the surgery itself takes about 20 minutes to perform. However, because you are receiving anesthesia on the day of surgery, it is important that you have nothing to eat or drink after midnight the night before. Furthermore, the morning of your surgery, if you need to take some medications, you may, but with a small sip of water. While the surgery itself takes about 20 minutes, you'll still end up spending a couple of hours with us in the surgery center. This is so that you can arrive, get changed into a hospital gown, have some eye drops placed to prepare you for surgery, have your IV placed, and then wait your turn for the surgery itself. While the surgery itself takes only about 15 to 20 minutes, you end up spending about half an hour in the operating room simply because we have to get you comfortable and in good position and get everything cleaned up in preparation for the surgery. After the surgery, you're in the recovery area where you receive some juice and crackers, and when you feel ready to go home, you will be discharged to the care of another individual. What that means is you have to bring a friend or family member to pick you up from your surgery. Because of your anesthesia, you cannot be discharged to a taxi or Uber driver or to your own personal self. You must be discharged into the care of someone else. Unfortunately, with COVID, we have had to make some changes to our protocol. I am grateful for the changes that we've made because they ensure our safety, both for ourselves, our staff, and our patients. 2 days prior to your cataract surgery, with surgery being on a Wednesday, that means on a Monday, you will have to be tested for COVID. This involves a swab going into your nose to obtain a specimen for testing. This has to be repeated for every cataract surgery. So if you have 2 surgeries scheduled 2 weeks apart, unfortunately you will have your COVID testing also scheduled 2 weeks apart. This testing is typically done through Suburban Hospital, and when you arrive for your visit, we can discuss the logistics of scheduling and presenting to Suburban for your COVID testing. I hope that this video has been helpful to provide a little bit of an overview into cataract surgery and some of the details that are applicable for patients who are planning to have surgery. At the end of the day, every discussion is individualized for each patient, and I look forward to having a chance to discuss all of these details as they apply specifically to you. I look forward to seeing you soon, and I thank you for your attention.